chiropractic doctor, then you are able to look at the full spectrum of someone's health.
Yep.
And you understand that in other seasons you are not perceived as the doctor best advised for health care, and yet when we look at our society and when we see the expense that's going for not only youth but adults towards the health, this seems like a much better way to go, something that I can manage and can see the benefits immediately by what I eat and keeping my spine adjusted.
Right. Well, you know, I heard this quote that says, health makes sense. And, you know, anytime I present information to patients, I go, does this make sense? And I'm like, yeah, it makes sense to move and eat and do all this, but it doesn't make dollars. So, meaning it doesn't make dollars for our healthcare, our healthcare system, which is not a healthcare system; it's a sick care system. So once you're sick, you know, the system doesn't show you how to get well again, because there's no profit in that. And I hate saying that, but the reality is if there was no sick people in America, that there wouldn't be the hospitals that we have. They wouldn't be expanding. Yeah. So our focus has always been, hey, let's show you how to stay well, so you stay out of the hospital.
Now, we know that there are wonderful people in that industry and wonderful hospitals, and when we break a leg, you've always said, you know, get to the hospital and get it set.
Yeah.
But as a consumer of healthcare, I've got to be well informed, and I have to be a non-victim by taking control and making my decisions. And as you just said, if it makes sense, then try it.
Right, absolutely. And that's really the thing that patients I see. You know, I've been dealing with thousands of patients over the year, is most of them don't know what health is. They just think it's when they feel good. And the reality is you could be developing cancer. Your arteries could be plugging. You know, the discs in your spine could be rotting. And you can have glaucoma developing and have no symptomatology at all. And in half the case of heart disease patients, their first symptom is actually death. And
that's true.
Which is sad, you know. So
let me get you to refocus here so I can change, because I've been looking at health of youth, but let's really take a look at health and children. We'll take obesity. What is your recommendation? What are you seeing, and what can we do to help our young people not be obese?
Right. Well, there's a couple things. The first one is getting them moving. I would recommend an hour a day of some sort of activity where they move.
Okay.
They get their heart rate up.
Okay.
You know, whether it's running, jumping rope, playing with their friends, parachute. I remember when I was in grade school, we played with these parachutes, and it was just fun. You know, basketball if you're into that, or volleyball, or swimming, some sort of activity where they're not just sitting.
Okay.
Or watching TV. So activity. The other thing is reducing the sugar. You know, don't sugarcoat breakfast. If that would be the biggest thing, is don't sugarcoat the breakfast.
Don't sugarcoat brequest.
Yeah.
Okay. What should I eat for breakfast?
Well, good question. You know, like we talked earlier, 51% of the food should be fresh, alive. So I'll give you an example. Like this morning, eggs. I had a couple eggs. Broccoli. Had avocado. Now, some people go, broccoli, that's kind of weird for breakfast, but if you do it right...
Like an omelet?
Yeah, exactly. Tomatoes.
Now, the eggs were cooked, right?
Correct,
okay.
Yeah. You know, and there's different sources that say raw is better. So we won't get into that on the show, but the more you can keep the food raw and alive, the better off it's going to be for you.
So if I'm a busy mom, I want to give our viewers a practical piece here. I can crack some eggs like I'm scrambling eggs, and then just cut up vegetables, maybe even some of the vegetables that I've had from the night before. Is that okay?
Absolutely.
That's not too bad. Okay, and stir them in there and then give them to the kids.
Yeah.
All right, that's my breakfast.
You know, it's funny. We were walking our dog the other day. We have a little dog. My wife and I were walking him, and we come up to our neighbor, and he's got this big, huge, beautiful dog. And he's like, "My, that's a little dog," you know. We're like, "Yeah, you've got an amazingly big dog." I'm like, "What do you feed the thing?" And he's like, "Well, we feed our dog collard greens." And I'm like, "Are you kidding me?" I said, "My dog would never eat collard greens." He's like, "Yeah, that's the way my dog was for the first 3 weeks." So he switched his dog food to collard greens, and finally the dog started eating them. And that's sometimes, you know, kids get used to eating these sugary fast. It's you know, you've got milk and sugar. Which is one of the demises of our healthcare system. So fresh, alive food, you know, and I you know, start the day off with something alive.
Remind our viewers then, what does sugar do to our system?
There's so many different things sugar does. Number one, it's very similar to cocaine and heroin in the brain. So it's got that kind of effect neurologically.
So there really is a sugar high.
Oh yeah.
And a sugar blues.
There's a book called Sugar Blues that talks about that whole thing.
Yes.
Sugar, it's that now they drive it out of corn syrup and stuff too, but it's in everything. And I believe that's one of the reasons we're so obese. It drives up our blood sugar. Okay. Then our pancreas has to work overtime.
Yes.
and then it burns out our receptors in our body.
Yes.
And now that is the recipe for type 2 diabetes.
Boy.
And then if you continue with type 2 diabetes, you know, limb amputation, blindness, neuropathy,
yes.
all these other things. So anywhere I go and speak, in churches, groups, they always want to know about how to prevent diabetes. And the number one thing is if we can eliminate sugar. Huge. And sugar comes in all forms. The high fructose corn syrup, that's code for sugar.
Yes, okay. All right, so I'm going to get rid of my sugar. I'm going to start eating more raw foods.
Yes.
What else I'm moving.
Moving. The other component that we teach is nerve supply. I've had many diabetics who come in, and if the bones of the spine shift out of alignment,
yes.
they start pressing on the nerve system. And if those nerves can go to the pancreas, can go to the digestive organs, the liver. These are all organs that help in processing sugar.
Yes.
So if those systems are malfunctioning, the body will never function and heal right. So critical to have regular spinal checkups, not for back pain or car accidents, but for promoting health.
Promoting health. And how young should a child start seeing a chiropractor for health?
Well, in my family, we just had our baby 5 months ago.
Yes.
She was adjusted within 2 minutes. So I knew, you know, the birth process could cause damage. So I checked her neck. Now, I didn't give her a big truck driver adjustment. It was really light, just a little light pressure on her neck. And it's been amazing because she's never been sick. She's never had a drug in her body or a chemical or a vaccine. So she's chemical free, as pure as we can keep her, other than what mom's eating. And mom's, you know, eating a very healthy diet too. The other thing I didn't mention was fat. Is, you know, now we pull away sugar from the diet. We're going to start putting good fats back in. And,
what are good fats?
Well, one of them is, you know, avocado is a great fat. Nuts, any seeds, those all have.
And what kind of nuts? Are some better than others?
Yeah, almonds are really good. Water-soaked almonds, those tend to be the best. They're very alkalizing. Cashews.
Okay, now let me back up. Water-soaked almonds. I know about organic almonds.
Correct.
What are water-soaked almonds?
So that's where you'd soak like a raw almonds overnight.
Got it.
And in the morning, they're also called blanching.
Okay, got it.
So very alkalizing when you do that. You want raw almonds too.
Okay,
Not ones that have been dry roasted because that alters the fat. Now
and that will help my health.
That'll help your health.
Okay,
absolutely.
all right. What else?
Fish oils, omega-3 essential fatty acids, you know, in the form of fish oils would be ideal. And you want to get the ones that aren't, you know, $10 for a big jug. You want to get the ones that are $40 or $50 or $60, the good quality fish oils. Because
my body can utilize it.
Correct.
Rather than just passing it through.
That and usually the ones from these big chain stores where they're selling them in bulk for really cheap, the oil is not very good. I don't know if you've ever had bad fish and you kind of burp up that taste.
Yeah.
Yes, it's rancid and it's very toxic to your system.
So what else can I do to help the health of my children?
Again, just loading up that fat. Even if you have like oatmeal or something, putting fat in there, even butter, you know, raw butter is a great way to help reduce that spike of insulin in the body.
Okay.
So you know, just going back to adding fat, getting rid of sugar, getting them moving, even getting in healthy activities where they're maybe reading or like Bible studies, things where, you know, positive things that you do with your children to build their self-esteem. That's why I like sports too.
And what about white sugar? You haven't mentioned white flour. I'm sorry.
Yeah.
What about white flour?
That's one of the no-nos. You know, we used to call it the three white guys. You got the white sugar, the white flour, and the white milk.
Yes.
Right. So we got to stay away from those three things because they just rob our body full of nutrients and